Dear learners, greeting. I'm happy to welcome you for that wonderful program, the certificate and diploma program on family counseling on behalf of Yellow Font International Academics. And this initiative, we made it because there are many people who want to be practice family counseling, but they are not having adequate knowledge. And another important hurdle the learners are having at present are they have to go to the place and they have to find the quality person for that program. And some of them are having the difficulty to travel from place to place and gain a knowledge. So we come up with an idea, online family therapy course for certificate and diploma program. And I hope this program will be very useful for you. And today, I'm happy to facilitate the module called Systemic Family Therapy. Okay, myself, Dr. Suresh Kumar. I'm the facilitator for the particular module. I'm going to let you know in detail regarding this module. I hope if you have any doubts regarding this module, feel free to contact me at any time. And systemic family therapy is very, very important thing. And we need to aware about it in a family counseling. And in that, I'm going to give you a brief intro about myself. I'm a professor and researcher and mental health practitioner from Madurai, Tamil Nadu, India. At present, I'm associated with the Department of Psychology, the American College of Madurai. I'm very keen in research studies and open to learn. And I'm really happy to say that I have constructed more than 100 psychometric tools. And I have published 32 journal articles and 50 conference papers and organized more than 1,200 webinar sessions and acted as a resource person for more than 400 webinars and online and offline training programs. I received few awards from the various sources and delivered few radio talks and television. And I have qualified UGC NET as well as education. And I have published 3 books also. This is regarding myself, and I'm going to make a disclaimer. For ease of understanding, I have included pictures and the sources where I have collected, I acknowledged properly. If you come to know that need to be acknowledged properly, feel free to contact me. My email ID is sureshkumar800@yahoo.com. Okay. I'm going to start with the key concepts. Systemic family therapy. We'll see one by one. What do you mean by therapy? When I ask these questions to the people who are studying in the behavioral sciences, they will give the answer, therapy is on treatment for the disease or illness. But actually what we mean here, that what we can call is that operational definition. What I mean in my presentation, therapy is a process provided by the trained professionals. What they will address during the process of therapy, they will address emotional issues and they will make you to emotional well-being and psychological well-being, behavioral well-being, and relational challenges. It will address the issues in these 4 components, we can say, as a therapy. The ultimate aim of therapy is to promote personal growth, improve mental health, and alleviate distress by exploring the thoughts, feelings, behavior, relationship in a confidential setting. We will understand that where the problem is there, how we can help the person to come out from the problem, and that we can call that therapy. Okay, the second important concept or term in that systemic family therapy is on family. What is the meaning of the term family? Family refers to a group of individuals, okay, who are connected by blood, marriage, adoption, or strong emotional bond. We can say, for example, the family members, my father, my brother, my friend, my classmates. So we can say, based on the study also, we can call us a family. And this is a definition for the term family. And family therapy is a process. As we know that therapy is a process in which trained professionals help the people to come out from the problem in 4 components. That behavior, emotion, and cognition and social components. And here family therapy, the ultimate aim of family therapy is to improve the family functioning. There is a conflict in the family, they cannot be able to function properly. It will help to resolve the conflict in the family. It enhances the communication among the family members. It fosters healthier relationship within the family unit. So that is a very important aim of family therapy. And there are many issues will be addressed in family therapy. I'm going to let you know some of the issues that will be addressed by family therapy. If you are seeking for family counseling or family therapy, what are the issues they focus and what are the issues they try to resolve it in the counseling process? One is about communication difficulties among the family members. Okay. And relationship conflicts between the couples, between father and children, between mother and children, and other family members. Okay, that conflict will be resolved. And parenting challenges. The newly given a birth by the family members, they have the difficulty how to rear. Parenting challenges, what are they? When they were newborn and when they were childhood, when they were adolescents, when they become adult, what are the challenges the parents will having? How we can able to help the people to come out from the challenges? And behavioral issues among the children and adolescents. Certain issues are very common among the children, and we can say that they are deviant. We are not able to notice, and when we are not able to regulate properly, and that may lead a lot of problem in the later stages. It is our duty as a family counselor and family therapist. We have to address the family issues at right time, and also we have to address the mental health issues. Mental health issues. And the people who are in a family, if anyone who are addicted to substances, and that also impact other members in the family. Okay, so we have to find out and right way strategies to overcome the substance abuse among the family members. And divorce and separation, how to cope up the divorce and separations that need to be trained. The resilience skills need to be given to the people and the family members when they were in the traumatic period. And if they lost someone in the family, it may be a loved one in the family members if they lost, and if they lost their family, if they lost their home, whatever it may be, and it is the time, the grief and trauma they may experience. It is our duty we have to address. Family counseling address. These are the very important components that will be addressed by the family counseling. Once again, reinstate that communication difficulties of the family members, relationship conflict, parenting challenges, behavioral issues among the children and adolescents, mental health issues among the family members, substance abuse, divorce and separation, and grief and trauma. These are the main issues, and there are many more issues also be dealt or provided proper counseling to the family members to come out from the problem. Okay, we will understand what do you mean by systemic family therapy. When we look at the systemic family therapy, in otherwise called family system therapy, or in general family therapy, that is the first therapy. Family therapy or systemic family therapy are the one considered as same. Okay, what is systemic family therapy? So it is an approach. We all know that it is an approach. Main focus of this approach is understanding the context of the family system and address the issues in the family system. That is the main ultimate focus or aim of the systemic family therapy. Systemic family therapy views individual as a part of interconnected systems. So the individuals are there, it views as an interconnected system. And one more thing, excuse me. Yes. So systemic therapy, we view individual as a part of interconnected system. The families are the, for example, parents, children, grandparents, they were interconnected with one another. Okay. And when we are interconnected, there are many components will influence. One is about their individual thoughts, their feelings, their behaviors. So it will have an impact among the members. If my behavior is inappropriate, deviant, it will affect the other members in my family. Other members' feeling, other members' thought will be influenced. The primary goal of systemic family therapy is to bring out the positive changes in the family members, their thought process, their feeling and behavior. The family systems aims to improve the overall function of the family, the functioning of the family. It's not about that only one part of the members or a certain components of family will be maximum outcome will be given. No. This systemic family therapy insists that very good functioning of the family. If there is a problem in the family, and it will be addressed, and they will make them to function more optimum level. So that is an ultimate aim of systemic family therapy. And what are the issues more specifically by the systemic family therapy will be addressed. Here are the 11 things it will be addressed. One is about communication difficulties of the family members, relationship conflict, parenting challenges, behavioral problems in the children and adolescents, family transition, emotional and mental health concerns within the family context, grief and loss, cultural and or identity conflicts, role adjustments, family support and resilience, substance abuse. We will see one by one. These are the issues that will be addressed by systemic family therapy. And I'm going to let you know a brief timeline for systemic family therapy. In 1950s, Palo Alto, the group family therapy, they focus on communication pattern in the family members, interactional dynamics within the family, what we can call as family dynamics. Sometimes all the members will be happy. Sometimes we can say some of the members will be happy. The dynamics will be studied. And that was an attempt made in 1950s. In 1960s, Murray and Bowen, they introduced family system therapy theory, family systems theory. And Salvador Minuchin, and he developed structural family therapy in 1960s. And 1970s, there are two important theories. There are strategic family therapy by J. Haley and group. And another one is very important, humanistic approach to family therapy was introduced by Carl Whittaker and Virginia Satir. They introduced humanistic approach in the family therapy in 1980s. And Salvador Minuchin, he also introduced one more component that we can call structural family therapy in 1980s. And Michael White and David Epstein, they introduced narrative therapy during that period. In 1990s, collaborative and solution-focused family therapy is very popular, and emotion-focused family therapy by Sue Johnson was very popular. And 2000, we can say integrative approach were introduced in the family therapy. We'll see one by one here. In 1950s, a group of researchers, group of therapists, they work out for the family therapy. Palo Alto group, including Gregory Bateson, Don Jackson, J. Haley, John Wickland, and Virginia Satir. They begin to studying that communication pattern and family dynamics. If there is a change in the family dynamics, we can able to make a positive attempt to resolve the conflict among the family members. And in the 1960s, Murray Bowen, they introduced family systems theory. And they emphasize that intergenerational patterns. See, for example, grandparents to parents and parents to us and us to that grandchildren. So the intergenerational patterns and dynamic within the family, they analyze and what are the things that need to be modified. That was discussed. And that's why we can say systemic family therapy theory helps to develop the systemic family therapy. And Salvador Minuchin, he developed structural family therapy that mainly focus on identifying and restructuring the dysfunctional family patterns, especially thought, the behavior and emotions. So dysfunctional means it is not appropriate, which is not working properly. That will be resolved by active interventions. In 1970s, we can see there are J. Haley and Chloe Madden. They contributed to the field within the strategic family therapy approach. They emphasizes strategic interventions and brief therapy techniques to address the specific issues within the families. And Carl Whittaker and Virginia Satir, they further developed an experiential and humanistic approach to the family therapy. See, they integrated with existing humanistic and experiential therapy into the family therapy. And 1980s and structural family therapy by Salvador Minuchin, and he gains very popularity during that period. He highlighted that the importance of family structure and the boundaries in the therapy. When we are setting the boundary among the family members, we can able to resolve many problems among the family members. And one more, Michael White and David Epstein, they introduced narrative therapy. They emphasize the power of stories and languages in shaping family realities. 1990s, the collaborative and solution-focused field therapy was introduced, gained prominent thing in that family therapy history. Focus on the strength and resources and solution rather than the problem. And emotionally focused therapy by Sue Johnson emerged as an influential approach that emphasizes significance of emotional bonding and attachment within the couples and family are very important for better family functioning. And 2000 and beyond, we can able to see that there is an integrative approach to the family therapy gain more attention and combining various theoretical orientations and techniques to meet the unique needs of each family members. And the family counseling is the field continue to evolve with a lot of recent researches and evidences, and with ongoing research and the advancement in the field, neurobiology and attachment and integration of new technology into therapy, there are new advancement is coming up in the family therapy. And you all got an insight regarding that the timeline of family therapy and timeline of systemic family therapy. I'm going to let you know the key principles or concepts in systemic family therapy. So here we are going to discuss the 5 important key principles or concepts in systemic family therapy. One is systems thinking, circular causality, family roles and boundaries, contextual perspective, and collaboration and feedback. We'll see one by one. What is systems thinking? Systems family therapies, they view family as an interconnected system. So system thinking means why they are thinking family, system thinking is important family counseling, because they think that family as a system. Because the family members are formed as a system. Each member's thought, behavior, and emotions influence one another. So when you make a change in one person, when we found that one person having inappropriate systems thinking or inappropriate thought, inappropriate behavior, emotion, that will cause other members in the family. So the therapist consider family dynamics, the roles and patterns that emerge within the family, how they contribute to the presenting issues. So that is a systemic thinking concept. They integrated in systemic family therapy. And circular causality. We have to understand that when we are attributing the problem to an individual, okay, so systemic family therapy that carefully examine how behavior and interaction between the family members that contribute for the particular problem, the particular issues. This mainly focus on understanding that circular pattern of the communication among the family members, interaction within the family system. If there is a poor communication and poor interaction among the family members, and that is the main cause for the problem. And family roles and boundaries. Systemic family therapists pay more attention to the roles and boundaries within the family. One is hierarchy, power dynamics, and rules. And therapists explore how these factors contribute to the family functioning and the presenting problems. And fourth important concept, principle is that the contextual perspective. We have to look at what context the problem arises. The therapy takes into the account the broader social, cultural, and historical context in which the family exists. When we look at that, that belongs to a particular culture, particular social culture, and that may also influence a lot of problems. So we have to understand context. And it recognizes the impact of social norms, the values of the family, the systems that directly connected to the family functioning. And the final important principle is that the concept is that collaboration and feedback. Systemic family therapy emphasizes collaboration and active participation from all the family members. Therapists often seek feedback and perspective from multiple family members to gain comprehensive understanding of the family system. And here is on key principles and concepts of thing. And the steps involved in systemic family therapy, I'm going to let you know. The previous one, you come to know that the key principles and concepts. Here, there are many steps are there in systemic family therapy. One is about engagement and assessment, creating genogram, identifying, presenting the problem, externalizing the problem, mapping family dynamics, interventions and techniques, enabling new perspectives, promoting healthy communications, building strength and resources, monitoring and follow-up. We'll see one by one. What do you mean by engagement and assessment? Here, the family therapists, or systemic family therapists, they will establish therapeutic alliance, what we can call as a rapport building with the family members, and they will also collect information about the family history, the structure of the family, and current challenges faced by the family. That is the first engagement will be done in the systemic family therapy. And it also involves that active listening to the each members of the family. And they will get into that, what is their perspectives. They will understand the relations and interactions. They will understand that when they're narrating, they will understand this concept. And they will create a genogram. Genogram is a visual representation of the family structure, who is the grandfather and who is having the problem and health issues among the members. Everything will be, we can able to understand by looking at the genogram. And it will say that the relationship across the generation, we can able to get clarity. A therapist helps the family to construct a genogram to identify the patterns, alliance, and conflict within the family system. And they will know that, oh, this is a problem, it is there. They will get on more insights. And identifying and presenting the problem. The next important thing is the therapist collaboratively work with the family to define the specific issues faced by the family and what are the concerns they are having. They bring it to the therapy. That will be discussed, and that include the identify the problematic behavior, identify the problematic communication pattern, identify the relationship dynamics. That is an identification process in that step. And fourth important step is an externalizing the problem. What they will do that? The person is the problem, no. The person is not the problem is the problem. So it is an externalizing. Systemic family therapists often use this technique called externalizing the problem, separating it from the individual to involved in that. If they cannot say that if I'm having the problem, it doesn't mean that I'm a problem. So problem is different, I'm is different. So that externalizing, that concept will be done in this systemic family therapy. That focus shift from blaming the individual and help to understand how the problem influenced by the entire family system. So that is a very important step here. And mapping family dynamics. Dynamics means it is not a same thing. You cannot see that there is a change we can able to see in the family members. The therapist help the family identify and understand that underlying dynamics and interaction that contribute to the presenting problem. This involves exploring family rules, roles, boundaries, and communication patterns. The rules set by the family members. What are the roles of the different family members? The boundaries. I cannot come to interfere in your area. The communication part and everything will be involved. Interventions and techniques. The therapist uses various techniques and interventions to disrupt negative pattern and promote positive changes within the family system. It may include reframing, circular questioning, enactment, and experiential exercise. We will see these strategies at later stages. And seventh important step in systemic family therapy is enabling new perspectives. The therapist encourages the family members to view the problem and solution from alternative perspective. Don't look at the one perspective, think out of the box. It helps the family members to gain a new insights about the problem, and they will get new insights about that various strategies available to solve the problem. They will consider the different ways they can able to relate with the problem. They communicate with each other and how we can differently more effectively communicate with other members. These insights they will gain. And promoting healthy communications. Yes, effective communication is very crucial for effective family functioning. Systemic family therapy insists effective communication. The therapist guide the family members to develop on new communication strategy. If the existing one is not appropriate, they will encourage them to develop an active listening skill, and they will help them to understand that conflict resolution techniques. If the conflict comes, how they can able to react, how they can able to respond to the particular conflict, and building strength and resources. Systemic family therapy emphasizes mainly on identifying and utilizing the family's existing strength and resources. If they need not, for example, if you are a systemic family therapist, need not to go and take a strategy. You find that strength and qualities, the resources available in the family itself, use those strengths for the treatment process. The therapist help the family recognize their capabilities, resilience, and positive aspect to facilitate change and the problem solve. When monitoring and follow-up, the last important step in systemic family therapy is monitoring and follow-up. Throughout the therapy process, the therapist regularly assess the progress made by the family. If there is an improvement, is there not? Why it is not happening? What kind of improvement it is going on? That detail need to be discussed. And follow-up session may be scheduled to provide ongoing support, maintain positive change among the family members, address any new challenges that arise. And now, final component we are here, the techniques and interventions in systemic family therapy. And here there are few, one is about genogram. When you try to visually present your family relationship and patterns across multiple generations, we can get an insight where the problem is there and who need to be addressed properly. That insight we can able to get. That very, very important exercise given by the systemic family therapist to the family members. So they will say that, I will say there is a problem with these relation, but the another person see that no, this is not a problem. So they will get more insight about that. And circular question, asking question that highlight the family interactions and relations. Okay, you will repeat that question. So you take the role when your husband and wife are in a conflict. You play the role of wife as a husband. The wife will play the role of husband, and the questions will be interchanged. So they will get more insights about that. And reframing, offering alternative perspective to the current conflict. An interpretation of a situation to promote new insight that will be given in a reframing. When their communication, when their affirmation is not appropriate, what they can do that they can make it more appropriate by reframing the statement, by changing the statement, and they will be more happy. Restructuring, facilitating changes in the family structure and dynamics to promote healthier functioning. And if the one person is the root cause, and we try to help the person to come out from for that, if the person is root cause for the whole functioning of the family, that need to be addressed more immediately. Enactments, when we have to play the role of other members, when the people are not understanding the problem of other members, and it is very important to promote, understand the problem of the people in the family members. Homework and assignments is very important, and assigning tasks to all the family members completed during the session and after the session must be evaluated, and proper feedback, constructive feedback need to be given. Assignments regarding if the counselor and systemic family therapist given some strategies, some advices, some interventions to the family members, whether they have done it or not, so that homework assignment need to be evaluated. So here are the few references you can utilize to understand further in depth about the systemic family therapy. I'll give an overview. System family therapy, they look at the family as a system. When the system has a particular part has a problem, it can be repaired by replacing the particular part. Or when they are making the changes in the particular part, they can able to function the system. Here, the same way, they believe that family as a system, when there is a problem in one member in the family, that can be properly addressed by effective intervention strategy. And in this presentation, you got an insight regarding the concepts, the key principles, the steps involved in systemic family therapy, and the strategies that can be used by the systemic family therapies to address the issues of the family members. So I hope this model give an insight regarding systemic family therapy, and I will come up with a few more models. And if you have any questions regarding this model, you can feel free to contact me. In your academic coordinator will help you to reach me, and you can clarify the doubts of yours. Thank you all. We will meet with another model. Thank you.